Hi, this is Kathia Castillo, and this is my final project for GPH 706. So hello everyone, I'm Jack Russell. I'm the new Executive Director for Healthy Community Brookfield, or HCB as many of you know it. I'm here with you all, the Board of Directors, to talk more about HCB turning it from a stranger to a community neighbor. So let's get started. So some of the goals that we have in place for the purpose of this presentation are to review my findings of the situational analysis that I did for HCB, also to review proposed changes to HCB's mission and vision statement, and to review the strategic plan and how it will be evaluated. So a quick overview of HCB. It's a 501(c) charitable nonprofit. We were established in 1998 thanks to a $2 million donation. We are dedicated to promoting and maintaining public health and wellness. We have around 97 employees. Thank you to the employees. We love you. Also, there's a variety of programs and services through grant and county funding. There's a lot of different types of programs that we have. So what's going on? What's happening at HCB? There's a lot of confusion regarding our offered programs and services. We lack a clear mission and vision. We also failed the Public Health Accreditation Board's Domain 9 standard, which is regarding quality improvement. So we have 3 different programs through the county health department that are in jeopardy because we might lose this contract because we failed this. Those are the prenatal and newborn care, the smoking cessation classes, and also the immunization services. We also have unstable employment due to program funding, and the diabetes education classes, the well water testing, and water mitigation assistance funding cycles are going to end in 3 months, so we will potentially be losing those 3 programs as well. We have a lot of environmental factors that are going into this. So on one good hand, the HCB is perceived as doing good by the community, which is great. The staff and you all, the board members, are viewed as dedicated, hardworking, and knowledgeable people. So thank you very much for that. But there's also confusion regarding who HCB is and what HCB does by the community and other organizations. One person specifically said that HCB is like a ship without a navigation system, rudder, or sail, which is not good. But we don't really have a strong presence or ties to the community. Our goals don't align with a lot of what you all think the vision should be, your vision. I know someone specifically told me that HCB should gather as many grants as possible to get as much money as possible. And we really need to be focusing on what HCB should be working on within the community and hone in on those factors. There's also an overlap of services among many organizations, and also the factor between private versus public healthcare. We're obviously a public healthcare organization, but there's also a lot of private organizations in the community that do the same things that we do or something similar. So I conducted a situational analysis, or SWOT analysis, as many of you know it, regarding the organization. I looked at our strengths, weaknesses, opportunities, and threats. So some of our strengths, we do have a very confident CFO. He was amazing. He stepped in 2008, really got the organization back on track financially. We also have contracts with the county health department, annual funds coming from the county. We offer programs and services at little to no cost. It's known as a good place to work, and our community board members, you all, you've been here with us for 15 years. You're well known in the community, and you've really gotten to know HCB as an organization. We also have a lot of weaknesses, though. With that being said, there's an unclear mission and vision. Our programs are contingent upon outside funding, which means that we may lose funding for several programs. I already talked about the funding cycle for 3 of our programs will be ending in 3 months. Also, we may lose our program for 3 other programs because we failed PHAB's Domain 9 standard. Our employees see a hierarchical organization, so some of them feel like their role isn't as important as the nurses or doctors, like the medical staff. There's also unspecified board term limits. Unfortunately, we haven't been able to get other board members in and get new and fresh ideas. I know a lot of you have been here for a really long time. I love having you here, but it would be really awesome to get some new faces in as well, some other community members, just to get a new perspective of different things and, get some fresh ideas of what we can do to better ourselves. Some opportunities with this: partnering with Brookfield County Schools. They there's an incredible opportunity for this. We can link up with them, particularly with the immunization program. We have a lot of teen programs, maybe offering these in the schools or, you know, somewhere more local or close to the students. That way they can have easy access to these programs. Also, there's minimal state-sponsored public health infrastructure. We can try to obtain more grant funding or money from the state versus just the county. That way we can expand our horizons. Also, the county health department, they have limited resources. They're struggling right now. We're already doing 3 programs with them, which we've already talked about, are in jeopardy of losing. But there are 3 programs that we're already doing that they don't have to do if we are able to turn it around and show them that we're able to improve our quality in these programs. We also already have a positive community image. So going out in the community and just rebranding and finding out exactly what it is that we need in the community to help the people the most will be a really great opportunity for us. But there's also a lot of threats. There's, like we talked about, lots of private organizations, large hospital. There's the health clinic, the VNA, nursing facility, places like that. There's community services and organizations. So we need to figure out a way to make sure that we are set apart. That's a big opportunity for us, rebranding HCB. Also, PHAB's accreditation requirement, that was a threat for us since we are in jeopardy of losing those 3 programs, but it's also an opportunity to be able to improve our quality in our programs. So our current mission and vision, I know you all know them. You've been with us for a very long time, so I'm not going to read them to you, but they're very long. As you can see, they're a bit confusing. Our staff doesn't remember them. The community doesn't remember them. They don't really know what we stand for. So I am proposing to you a new mission and vision. So here, the new mission that I'm proposing is HCB strives to improve the community's health and wellness through local education, prevention, and medical services. The new vision I'm proposing is the Brookfield community to lead happy, healthy, and quality lives. These are very short and sweet. They bullet point exactly what we as an organization stand for and what we are going to do to serve the community and what we will do for the community. So different strategies, 5 different strategies that I am looking to implement over time. I've broken down by community, partnership, quality, funding, and employees. So we're going to talk about these a little bit more in depth now. So part of that, I have an action plan to come up with those strategies. So with the community, we really need to look into identifying community needs, building community engagement, things like that. So who's going to do this? The board members, you all. You already have a close relationship with the community. You're already known out there. You're very public figures in our community. So you all, the public relations director and the community workers, they're already out in the community. They're already working with this population. So you all are going to be responsible for this. We're going to do rebranding and promotion of HCB. We're going to do some events in the community to get more awareness. We're going to identify the health disparities specific to the community and the needs for service based off of that, and underserviced areas. That way we can get in there. I really want to try to do this within the next 6 to 12 months. That way in 2 years from now, 3 years from now, we already are rolling based and servicing those underserviced areas with those health disparities and the needs that are really needed in the community. Partnership in the community is building relationships, wrap around with the stakeholders. So the public relations director and me, the executive director, we're going to identify 3 stakeholders or community organizations to partner with each year. That way in 2-3 years from now, we have a network of people that we are working with. Quality. PHAB, we talked about this several times already. The quality improvement director and the program managers are going to be responsible for quality improvement. So we're going to implement new objectives in each program and a new performance management system. That way we can track quality and make sure that we're doing this the right way. So we're going to implement it in 6 to 12 months. We're going to review this annually. That way each year we can really focus in on where we can improve and how we can improve it. So funding, we need more grants. We need to make sure that we are stable, having less turnover. So our CFO and the board members, you guys are going to be responsible for reviewing grants and funding and the annual budget each year, each fiscal year. And that can also trickle down to the program managers and making sure that their programs are being held accountable for the specific funding that they have. And employees, we need happy employees to lead a happy organization and for them to want to do their jobs. So HR and program managers, they're going to host annual trainings to make sure that these employees feel confident in their jobs. And we're going to do annual evaluations to ensure that quality is being implemented. So we're going to do this in 6 months. We're going to start having these trainings and evaluations, and we're going to do this annually. So our strategy evaluation, we're going to have participant surveys upon program completion, see how they liked it, any feedback from them, because their voice is very important and we want to make sure they feel heard. We're going to measure quality using PHAP standards per evaluations. We're going to have annual staff evaluations, make sure that the staff knows what their strengths and weaknesses are, what their opportunities are. We're also going to have an annual employee feedback, anything that is on their mind, seeing how we can improve better as an organization. And an annual meeting in a box for employees to review HCB's mission and vision, make sure they understand what it is, and identify strengths and needs for improvement in the organization. So basically to conclude, we're going to focus on HCB's mission and vision to guide us through this process. We're going to evaluate all of the programs and services to ensure that they are needed in the community and meet quality standards. So this might mean that we're going to cut down on some programs, or maybe we'll combine a few. I know in the past, a lot of the programs were implemented because of staff interest or because we got a grant for it, and that's not the way it should be. We're going to really turn it around and make sure that it's needed in the community and that there's a need for it. We're also going to gain partnerships and community support and engagement. So yes, there's a large local hospital. Maybe we can partner with them, and once they have a client who's discharged who may need diabetes counseling or training or, something like that, maybe we are the ones who can go into their home and talk to them about things like that. Also, having happy employees. We really want to make sure our employees feel needed, that they're wanted. We want to make sure that they know that they're valued. Because a happy employee leads to a happy business, as I said before. So thank you all very much for coming. I really appreciate all the time and effort you put into this organization. Cheers. And here are my references.